Have you ever found yourself in a situation where visiting the doctor seemed like an overwhelming task? Perhaps this was due to a busy schedule that left no time to go to the clinic or a pressing need for medicine without a prescription in hand. Well, you're not alone. Today we will be exploring virtual health, an innovative solution that will change the way we access and experience healthcare. Virtual healthcare was initially implemented to prevent the spread of COVID-19 in clinics and hospitals. Surprisingly, during the first 4 months of the pandemic in 2020, 71.1% of all primary care visits were virtual, a significant increase compared to 1.2% in the same period of 2019, and has since surpassed its initial purpose, offering a multitude of benefits that extend beyond the pandemic. You may be asking, what exactly is virtual health? It is any interaction between patients and their circle of care occurring remotely, using technology as a form of communication to monitor and treat patients. This includes video calls, phone calls, texts, and emails. What started as an emergency response to the pandemic is becoming more and more popular now due to the feasibility and convenience virtual health brings to the table. Notably, a survey conducted by the Canadian Medical Association showed that 91% of respondents were satisfied with their virtual care. Whether you're in a remote location, managing a medical condition, or simply do not have the time to attend an appointment in person, access is no longer a barrier. In 2019, before virtual health was practiced more commonly during the pandemic in 2020, virtual health initiatives saved 11.5 million hours, eliminating the need for extensive travel. This translated to a substantial $595 million in savings related to hotel stays, travel costs, and other expenditures. Now, please welcome Dr. Anna TV, an assistant professor in the Department of Interdisciplinary Science, who will discuss the benefits, limitations, and implications of this mode of medicine. She recently published a research article examining virtual health, titled A New Dimension of Healthcare: The Benefits, Limitations, and Implications of Virtual Medicine. What are the key benefits of virtual health services for both patients and healthcare providers?
Some of the key benefits for virtual healthcare services for patients is that it allows patients better accessibility overall to physicians and or medical staff. When there is the necessity for people to travel to and from the doctor's office or to a hospital, it can be time consuming, expensive, and difficult to manage. With virtual options, patients have the ability to see a physician or a medical professional in the comfort of their own home over the internet or over the phone. And so then this improves the overall experience and hopefully the accessibility. With respect to healthcare providers, it allows for better efficiency. A healthcare provider has an easier time being able to interact with patients back to back in subsequent appointments through a virtual call than they may be able to with a physical call. And it also may expand out, improve numbers of individuals who can participate and provide care in this context.
What challenges do healthcare professionals face when adopting virtual health technologies?
Virtual health technologies are dependent on resources, particularly electricity and access to the internet. And so in areas of the world where there is limited access to electricity or problems with infrastructure relating to Wi-Fi, internet, etc., that can be problematic when it comes to people being able to access a healthcare professional in this way. There's also challenges relating to training because virtual health technologies do require some education and training on the part of staff and physicians to be able to use these technologies.
What are the potential barriers and concerns that may impede a patient's access to virtual health services?
Some potential barriers and concerns relate to simply accessing and having access to virtual capabilities. So this may be consistent access to electricity or the internet. It may be access to the technology itself necessary for using virtual health services. If a person doesn't have their own computer and has to use a public computer source, or if they don't have their own phone and have to rely on other sources or public sources, that can be a barrier. Concerns relating to virtual health services many times relate to the knowledge, or the data itself that's being conveyed and shared. So there's concerns around data security, data storage, identity, and how well this information is kept safe. And so these are some of the potential concerns.
How does the effectiveness of virtual health consultations compare to traditional in-person visits? Are there specific aspects of healthcare that necessitate in-person interactions?
While I'm not a physician, I have been a person who has used some of these virtual health consultations, particularly during the pandemic, as I'm sure many people did. Now, virtual health consultations can be quite effective if they're meant on a consultation basis. So if you need to talk to a physician and talk through a situation or get advice or guidance with uncomplicated symptoms, perhaps it can be really, really effective. But in some circumstances, it's necessary to see a person in person, or at least it's much more difficult to do a full assessment without the ability to physically interact with the human being. So one example may be where someone needs to be touched, or they need to have something physically examined that cannot really be well conveyed through a camera. And so in this context, there are some limitations that may necessitate a person having to come in person. There are ways around this, and technology is getting better. And certainly, as technology improves, there are hopefully better ways to be able to do video-based assessments in the future.
What does the future of virtual health look like?
That's a great question, and honestly, I don't know if I can answer that. I think that we've moved into an era where, or a time frame in history where more and more virtual medicine options will be available. Certainly, there are, private and public companies and or initiatives that have been moving forward to improve healthcare access overall, and virtual health contributes to that and may help to assist and offset some of the pressure points on our healthcare system. I think virtual health looks like an integration and normalization of the usage of virtual health as people become better connected and more consistently connected, through the web. And I think that other virtual healthcare options with respect to remote treatment, even remote surgery, will continue to improve as technology advances and improves.
Thank you for listening to this overview of virtual health. For more information, please refer to the resources provided in the description box, and don't forget to hit subscribe for more videos from Demystifying Medicine McMaster.